A huge share of healthcare costs come from visits to specialists and high-tech surgeries or other interventions when people get acutely sick. One line of thought in healthcare is trying to prevent as many of those sicknesses as possible to begin with. One healthcare system in the eastern Adirondacks is trying to make small, everyday healthcare more accessible and closer to home, hoping people use it more so they won't get really sick later. Hudson Headwaters on today's story of the day.
Support for Story of the Day comes from Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hey, I'm David Summerstein. It's Thursday, November 9th. First up, the new bridge between Long Lake and Newcomb that was washed out by flooding last July is finished, and it's more resilient to future floods. The bridge on State Route 28N over Fishing Brook was closed for 3 weeks in the aftermath of those floods. Then a temporary steel panel bridge was installed to restore travel. According to Governor Kathy Hochul's office, the new permanent bridge is 30 feet longer than the previous span. It also has a wider opening that will allow better water flow and improve flood resilience. Finishing work will take place over the next few weeks and may require periodic lane closures on 28N. Many North Country hospitals have affiliated with larger networks outside the area. This regionalization of healthcare allows local hospitals to provide specialists and technology that isn't always possible in our rural area. One healthcare provider is taking a different approach. Hudson Headwaters is a network of small rural clinics that offers minor care to prevent major health issues to keep people out of hospitals altogether. For the next chapter in our healthcare series, Emily Russell reports.
If you live in the North Country, you could be at least an hour's drive from the closest hospital. There are only a handful of hospitals in the entire Adirondack Park. Jonathan Maskin lives in Indian Lake, a really small town deep in the Adirondacks. He says that lack of emergency care in the park is really scary.
It's Russian roulette, to be honest with you. You know, if you're really in need of something urgently, you're in trouble.
Maskin is in his late 60s. He drives an hour and 40 minutes to see a specialist at the hospital in Albany. But for basic checkups, Maskin says he's lucky. There's a health center right in Indian Lake. It's run by Hudson Headwaters Health Network.
Where Hudson Headwaters comes in to a point is provides good primary care, which is preventative healthcare services, which is really, really important.
Hudson Headwaters is not a hospital system. It's a network of small clinics in 7 North Country counties. The aim is to provide primary care in lower-income places that are also considered medically underserved. Actually, Hudson Headwaters is required to do that. That's because it's what's known as a federally qualified health center, or FQHC.
It's a federal designation that you have to meet some pretty specific requirements around geography, needs assessments.
That's Kevin Gallagher. He's a family doc for Hudson Headwaters in Warrensburg and Glens Falls. One key requirement of an FQHC is that they always have to accept new patients, regardless of insurance.
We're essentially a primary care safety net provider. We're supposed to be available to anyone who needs care and be able to provide that fairly and equitably in any community.
It's able to do that with significant help from the federal government. At an FQHC like Hudson Headwaters, the government ensures a set reimbursement rate, regardless of what an insurance company offers. So if a visit costs $150 and an insurance company only pays $80, the government makes up for the difference. The whole idea behind Hudson Headwaters began in the mid-1970s. A few docs, including its founder, John Ruggie, wanted to provide care in communities where there was no other option. But by the late 70s, it was clear that these rural independent health centers were losing money fast. Here's Ruggie in a video from Hudson Headwaters' website.
And losses that were becoming unsustainable, and the hospital reimbursement had been constrained during this time. So I had a letter in my drawer indicating we were closing the Chester Health Center.
It was at that point, Ruggie says, that they applied to become a federally qualified health center. Hudson Headwaters started in Chestertown in Warren County. Today, there are 22 health centers around the region, from up in Champlain over to Tupper Lake and down to Whitehall. And the network is growing.
For now. So this is all the new space. So we added 7 additional rooms here. So, and they're good-sized rooms.
Melissa Gooley is giving a tour around the Hudson Headwaters Health Center in Saranac Lake. The facility opened in 2020, and this fall, it's doubled in size. Again, the idea is to provide primary care that's preventative. And Gooley says this facility is set up to do a lot.
You have a little lesion that you want removed to see if, it's cancerous or you're worried. We have providers that do that here. We do pap smears here. We do joint injections, a lot of those things.
Being a federally qualified health center opens Hudson Headwaters up to a lot of federal grants. And its growth over the years has allowed the network to hire a team focused largely on that whole aspect of the business. That sets it apart from smaller, private, independent doctors' offices around the region. But it doesn't solve the staffing crisis that plagues rural places like the North Country. State Assemblyman Billy Jones, who represents Franklin, Clinton, and parts of Essex County, was on the recent tour in Saranac Lake.
I think the number one issue when it comes to healthcare here in the area, from what I have been hearing in the last 3, 4, probably even longer than that, 6, 7, 8 years, is how do we get providers here and how do we retain those providers?
This is another aspect where the federal designation is essential for Hudson Headwaters. Providers who work at an FQHC qualify to have their student loans repaid over time. The government also offers malpractice insurance to all of its providers. While that doesn't solve all of its staffing problems, Dr. Patricia Monroe says the stability of Hudson Headwaters gives the network a leg up.
It's pretty obvious that probably Hudson Headwaters is a sustainable practice. So that allows you to recruit more. And if you recruit them, well, then obviously you feel more comfortable then and you can recruit more. So it feeds on itself.
Meanwhile, Hudson Headwaters is trying to reach even more remote places by sending a mobile clinic. The network's chief operating officer, Patty Hammond, says patients in the Washington County town of Salem had been asking for more care there.
So we take the mobile van and those patients get care Mondays and Tuesdays. And then we established ourselves, and now we're looking at the possibility of building a healthcare center in Salem.
In these small rural towns, Hudson Headwaters has filled a gap. Local health centers like the one in Indian Lake offer not only primary care, but at times they can help in emergencies. Town Supervisor Brian Wells says he had plenty of those when he worked as a contractor.
I was there constantly getting stitched up. I shot a nail through my finger. I took a board to the forehead and split my own. So, for emergency care, they do what they can.
Which is more than what most other towns in the Adirondacks have access to. Even for towns that do have local doctors' offices, Wells believes those offices are more vulnerable than the ones that are part of the Hudson Headwaters network.
When these people retire out of the system, where are you going to find somebody to come take a small practice? You might, but, with Hudson Headwaters, if we lose a PA, they'll send somebody else up.
A fact that Wells says is really reassuring, both as a patient and a town official. Hudson Headwaters has plans to open its next health center in Malone this winter and another in Lake Placid next year. Emily Russell, North Country Public Radio, Saranac Lake.
The story is part of our series Imperfect Solutions on healthcare in the North Country. You can find all the stories on our website, ncpr.org/healthcare. We have more news all the time on our website on the homepage, ncpr.org. Music today by Tim Ellifritz of Johnsburg and Martha Gallagher of Keene. I'm David Summerstein, North Country Public Radio.